Hello, this is Dr. Rayleigh over at Incline Chiropractic, Colorado. Today I wanted to talk to you about masks and the different things that they can be doing to your jaw as well as to your neck, depending on the mask that you have decided to wear. So I have several different options that I've tried here in the office that I've found have either caused, neck pain, headaches, or jaw pain. I'd like to start with this mask. This is an industrial grade mask. It's meant for prevention of like silicosis. It's for people that work in industrial parks that have a lot of sawdust or dust from the road or things like that. So these are actually very difficult to breathe in because the point is to keep things out so that you don't develop silicosis and you have the sand in the lungs and different things like that. So I wouldn't recommend these because they definitely decrease the amount of oxygen that you can get into your system. So next is going to be just a regular mask you've probably received if you've gone out somewhere and you forgot your mask and they were like, oh, well, we have one for you. These are nice. They're breathable. The elastic allows it to go around your head. However, the part for the mouth, depending on the person, it can be kind of small. So like on me, it's very restrictive of my jawbone, so it makes it hard for me to talk. It actually holds my mouth shut. So I feel like I'm clenching, and the muscle that's right here on either side of your jaw is called a pterygoid, and it just causes this clenching, which can create headaches. And I don't know if you could hear me through the mask, so it was keeping my mouth closed, I was clenching, it was irritating my pterygoid muscles. And then it would give me a headache if I was wearing it for longer than 5 minutes. So these are okay as long as they fit you nice and they're not pulling your jaw back like this, because then it can be very hard to talk. So actually that brings me into the next mask, which are these really cool ones that a patient has actually made for me. It has just little rubber bands on the side and it's a cloth mask. It works great. It's a good breathable material. I can wash it, which is really nice. However, because the straps aren't long enough, it actually pulls my jaw back. So whenever I have it on, my jaw's back like this. And so in order for me to talk to my patients, I have to jut my jaw out like this so that I could talk, which is irritating my TMJ because I have to push my jaw out in order to be able to speak to patients. So good, but you need to make sure you have the right size to go around the ears, or that's going to cause TMJ problems. The next one is going to be these pullovers that you've seen some people wearing, and I've seen a lot of skepticism on people that wear these. However, as long as you have a mask on, it helps. No, you're not going to not get coronavirus because you're wearing one of these, but it can help you from spitting and like projectile, just spitting into the air so that other people are getting your germs and whatnot. But these are good as long as they fit. So if it fits over your mouth and it stays there, it works. If you have one that doesn't fit and it starts falling down off of your face and you can't keep it up, then what's the point? And then the last thing you want to do is try and layer it up so that it stays over your mouth. And then it's effectively doing the same thing where it's pulling your jaw back and it's causing that TMJ problem, or you're jutting your chin out, also causing TMJ and the headaches and the different things. So the last mask that I have in the office is just one of these medical grade masks. These are nice because they fit relatively well. They're, pliable in the front so that your mouth can move relatively easy without feeling like you have to jut your chin out. But again, it just depends on the person if it fits. If it fits all the way around your mouth really nice and you can talk through it without having to go like this and jut your chin or pull your chin in, then yeah, these ones are really nice. But they're disposable, so you can't reuse these ones over and over and over. You should be throwing these away. So, in honesty, I would probably use a mask that ties in the back. Those ones are good because you can tie them so that your jaw feels good and that you're not giving yourself a headache. Because the TMJ, it's attached to the muscles that are actually right here on your temples. It's called the temporalis muscle. And that's what gives you that bite force, is this muscle right here. So if you've noticed a lot of headaches now that you've had to wear your mask all day long at work, or if you're having like a lot of tightness in the back of your head, it could also be from the jaw too, amazingly enough. So if you guys have any questions about your masks or where you could go to buy a tie-on mask, let me know. Or if you have a really great suggestion or a mask that you found that works really well, also let me know, because I'd be more than happy to share those locations with everybody else. Okay, so now that we've talked about masks, I'm gonna talk to you about what you can do at home to help with pain management, as well as some stuff that I do here in the office to help my patients. So usually people that present with the jaw pain and headaches and neck pain, I'll start with the jaw. So I will do the temporalis and the pterygoid muscles, and I'll do pin and stretch. And all that is you pin the muscle that's underneath the cheekbone here, and then you slowly open like that, and you should feel a pretty tight, tense pain under there. So I send patients home with this exercise too, so they can pin it and then stretch, and you feel a really good stretch on that muscle. It helps break up the fascial adhesions, as well as bring in oxygenated blood and allow the muscle to relax. The same with the temporalis muscles, so I'll do a little bit of massage on them and then have them close their mouth and pin that temporalis down and then slowly open. And you'll be able to feel this muscle when you bite down like that. It'll stick out on the side. And then slowly open and kind of get that to release. I'll also do a suboccipital release. So let me get my tiny little spine here. So this is your occiput, which is the back of your head. And all I'll have patients do is lay down and put my fingers right at the base of that occiput where those muscles become tight, and then just push straight up. And then gravity does the rest of the work. It releases all the muscle tension that's in that area, and it also makes it a lot easier for me to adjust. So after I do the muscle release, I will adjust patients' necks. I'm not hunting for that popping sound. I just want to increase the motion that's in those joints, because that'll get the inflammation out, as well as help those muscles relax. And not all patients get a manual rotation type adjustment. I'll use the activator tool or the arthrostem based on patient preference. And then I can even adjust the jaw. So a lot of patients, whenever they open their mouth, it doesn't go straight down and straight up. It'll kind of zigzag to the side, or it'll open and then it'll pop to one side and then it'll pop back when it closes. And so that's just your TMJ rolling over that cartilage that's in there. So I will adjust that joint with my activator as well. So usually I'll have you open, and then I'll find where your TMJ is, and I'll just click there and click on the other side, and then right on the tip of the chin, click. And then I have all the muscles loosened up and all the oxygen going to them. And then of course I use essential oils on most patients, as long as their skin doesn't have a reaction, just because the aromatherapy really helps those muscles relax. As well as promote deep healing. So the oil goes into the fat cells, and it actually promotes that healing to occur. So it takes the inflammation out of the area and just cleans it all up. So if you guys have any questions or would like to come in and get everything assessed, please give me a call. The office will be open Monday through Friday, and we would absolutely love to have you in here if you need it, of course. Otherwise, you guys have a good rest of your day. Thanks.